So the standard lead 1, lead 2 and lead 3. These 3 leads are bipolar leads. AVR, AVF and AVL. These all 3 leads are unipolar limb leads, conventional unipolar limb leads. And V1, V2, V3, V4, V5 and V6. All 6 leads or precordial leads are also unipolar leads. So remember always, all unipolar leads are termed as V. So what is bipolar and what is unipolar? The lead is recording the difference in the negative and positive electrode. Here we can see in galvanometer. So this is the again heart is here. The electrode is placed here. The electrode is placed here and the electrode is placed here. This is the right arm, this is the left arm and this is the foot or left leg. Now the conventional standard limb 1, how this lead 1 or the first standard lead is constructed. It consists 1 positive and 1 negative electrode. So this is the negative electrode and this is the positive electrode. We can place the electrode here. So this is the first standard lead, which is looking the heart from the above side and from the left lateral. This is the orientation of this lead. Limb 2 or standard limb 2, lead 2. This standard lead 2 is constructed by placing the negative electrode on the right arm and the positive electrode on the left leg. This is the negative electrode and here it is the positive electrode, which is looking the heart from this side. The standard limb lead 3 or the third conventional lead. This lead consists 1 positive and other negative electrode. The positive electrode is placed on the left leg. And the negative electrode for third standard lead is placed on the left arm. This is the negative electrode. This is the lead, standard lead 1, standard bipolar lead 2 and standard conventional bipolar lead 3. These three leads, the lead 1, the lead 2 and the lead 3, and these all three are looking the heart from three different directions. Limbs are considered as the extension of the torso. So these electrodes can be placed on any part of the limb. These can be placed on the shoulder, on the elbow or on the wrist. But remember always, if the electrode is placed on the shoulder of the right arm in case of amputation or some other problem related to clots or some other, the left one should also be placed on the shoulder. If the right is placed on the wrist or on the forearm, the left should also be placed on the wrist or forearm. So these three leads are forming equilateral triangle. The lead first, the second and the third. All three leads are forming the equilateral triangle. Here we can see the triangle. Heart is placed on the center of the triangle. This is the first standard lead, the second and the third standard lead. So negative electrode of the first lead on the right arm, positive electrode on the left arm. For the lead 2, the negative electrode is placed on again on the right arm and the positive on the left leg. For the lead 3, the negative electrode is placed on the left arm and positive electrode is placed on the left leg. These standard leads were first described by the Eintwon. These were first described by the Eintwon. So this triangle is known as Eintwon triangle, and this triangle is formed by the standard limb lead first, second and third. This is the heart and this is the Eintwon triangle. So these three leads out of 12 leads are bipolar leads and known as the conventional standard limb leads. Besides these 3 leads, in the limbs, there are 3 unipolar limb leads. 3 unipolar limb leads and this is the left leg, right leg. The electrodes are having some color. Red is placed on the right arm, yellow is placed on the left arm, black is placed on the right leg which acts as the earth, and the green is placed on the left leg. So these are so when we go away from the heart, the intensity or potential of the electric current or the vector decreased rapidly. When we go away, or the electric vector go away from the heart, the intensity decreases. This is very intense, less intense, but after 15 centimeters, when we go away 15 centimeters from the heart, this difference in the voltage or amplitude is almost negligible. So if the lead is placed on 25 centimeters away from the heart, or the lead or electrode is placed 35 centimeters from the heart, the difference in the voltage of 25 centimeters and 35 centimeters is almost unnoticeable. In that case, all electrodes are placed more than 15 centimeters from the heart, so the amplitude or voltage is unrecordable. So AVL, AVR, AVL and AVF, these all unipolar leads are instrumentally augmented. These all are instrumental augmented leads. So AVR, AVL and AVF, all 3 unipolar limb leads are augmented instrumentally, so known as augmented voltage right, augmented voltage left and augmented voltage foot. All 3 leads are unipolar limb leads but augmented instrumentally. So these are 6 limb leads which are looking the heart in the frontal or in the coronal plane. There are 6 precordial leads. The anterior chest wall, which mark the heart on the surface, is known as precordium. This is the manubrium and clavicle. This is the first rib, and this is the sternal blade or sternum. So first, second, third, fourth, fifth. And the sixth rib. This is the outline of the heart, roughly 2/3 in the right and 1/3 in the 2/3 in the left and 1/3 in the right. So there are V1 to V6 precordial leads. Again, the term V is applied for the unipolar leads. So electrodes are placed on the V1 on the fourth intercostal space in the right. So this is the first, second, third and fourth. The first rib is hidden under the clavicle. So this is first, second, third and fourth. So this is the electrode V1 and also forming the lead V1, because this is the unipolar lead. And on the left side on same plane there is V2, V1, this is V2, V3 is not having its own location. So this is the electrode V1, or I can say lead V1. In case of precordial, these are unipolar. So the active electrode is recording the true potential, and the negative electrode is constructed by zero potential. Negative by zero potential. So absolute potential is recorded by these electrodes. So these electrodes are also forming the leads of the precordium or the horizontal leads. The lead V4 is placed in the mid clavicular line of the fifth intercostal space. This is V4. V5 in the same plane in anterior axillary line, and V6 in the same plane in the mid axillary line. This is the anterior axillary line, this is the mid axillary line, and this is the mid clavicular line. V3 is placed between V2 and the V4. So again we can see the placement of leads in the horizontal leads. This is the precordium, the part of the anterior chest wall occupying by the heart. Lead V1 is placed in the fourth intercostal space in right, just right to the sternum. V2 in same plane but in left. V3 is having no having its own position. V4 in the fifth intercostal space in mid clavicular line. V5 in the same plane but in anterior axillary line. V6 in same plane but in mid axillary line. V3 is positioned between the V2 and between V4. In case of unipolar leads, either these are the precordial leads or these are the unipolar limb leads. The active electrode is recording the true potential or absolute potential, but the negative electrode is recording zero potential, or absolutely zero potential is recorded by the negative electrode. So these are unipolar lead, and the active lead is recording the true potential V1, V2, V3, V4, V5 and V6. These leads are looking the heart from the anterior and from the left of the heart and in the horizontal plane of the heart. In next lecture, I will talk about the importance of the left ventricle in the ECG and how the waves and segments and intervals are generated by these leads.